I don't think my working life will ever be the same again. And I remember saying quite confidently, like a great forecaster, when people were talking about how the next 4 to 6 weeks were going to pan out when we started having these conversations in the middle of March. I felt quite sage and wise saying, well, do you know what? I think we might be needing to think about something for 6 months. And there were gasps around the room. And it turns out I don't think I was so clever at all, because 6 months is a pretty conservative estimate for how long this is going to impact on us. Um, it feels like there'll be a permanent change because there's no one untouched by this, and the kind of social and economic effects are so great, and the impact of those things on people's lives and well-being and futures is going to be very great. And as a health and well-being organization, we're going to need to respond to that anyway. In terms of how we practice, I hope that there'll be many good things that come out of it. People were, for the most part, collaborative in their approach. Lots of the barriers for working across different systems came down. They took quite a pragmatic approach. And a lot of the time, I think people were very person-centered. People were happy to say to patients, what do you need from us right now? We may not be able to provide it all. And I hope that there's a long legacy of that. Some of the walls are beginning to come up again, the silos between, oh, we don't do that, or we do, et cetera, et cetera. So that might be not a permanent effect. But I'm hoping that some of the good stuff, especially around innovation and change, will be maintained. I think how we interact with each other as humans within the health system will be different. Our view of infectious diseases, how willing we are to touch hands, whether, hold hands, how we occupy the same space with or without masks. I think the legacy of that will be really long, and that's sad, that part of it. I think I will do so many more telephone consultations than I did before. And, it's kind of shaming realizing the people we dragged up that we didn't need to, and how easy it is just to be stuck in an old-fashioned system. And, there'll be good things about that changing. Whether there'll be the blanket acceptance of video calling and video consultations, I don't know. There was a little bit of appetite for it amongst the cardiology patients at the beginning. Now many more of them are saying they would prefer just to have a telephone call. They can't be bothered with the video part of it. So we'll see. I'm not sure about that. And in terms of funding, I think, yes, in Scotland certainly we're feeling that there's a real impetus to change the way that unscheduled care takes place. And a deadline, in fact, for the end of this month for boards to look at how they're going to provision care for people in an unplanned way, really differently and radically, and much more based within communities and so on. I'm sure that's going to have long-term funding implications too.